Hello everyone. In this video, I will be sharing a medication review and highlights. Fidaxomicin, the brand name DIFICID. Fidaxomicin was initially approved by the US FDA in 2011 for the treatment for C. difficile-associated diarrhea. Now, let's dive into this medication in more detail. Fidaxomicin, brand name DIFICID. This medication was initially approved by the US FDA in May 2011 and currently indicated for the treatment for adults and pediatric patients aged 6 months and older with Clostridioides difficile-associated diarrhea, CDAD. CDAD, formerly known as Clostridium difficile-associated diarrhea. Chemically, this is a novel glycosylated macrolide antibiotics containing a highly unsaturated 18-membered macrolide core, so which you can see that's the core motif in the middle, with narrow spectral activity against C. difficile. So C. difficile is a gram-positive bacterial pathogen, but this medication is not active against the gram-negative pathogens. This medication is available as a film-coated tablet. The strength of the tablet is 200 mg. It is also available as oral suspension, 200 mg per 5 ml. That's a 40 mg per milliliter oral suspension. Recommended dosage for adults or pediatric patients, weights greater than or equal to 12.5 kg, which is 27.5 pounds. 200 mg, that's one tablet taken orally twice daily dosing, with or without food for 10 days. For pediatric patients, weights between 4 to 12.5 kg, which is 8.8 pounds to 27.5 pounds. It's weight-based dosing. Please refer to prescribing information for details. Mechanistically, this medication inhibits the sigma subunits of bacterial RNA polymerase and subsequent RNA synthesis. Pharmacokinetically, absorption minimal. As you can see based on the chemical structure of this drug molecule weight is 1,058.04 gram per mole. So therefore you can see this is a relatively large molecule. The log P is over 9. So this is a pretty lipophilic drug molecule. And in this case, the systemic absorption is minimal. But you can see for this particular indication, C. difficile-associated diarrhea, it's ideal because this medication works more in the GI tract locally, so it's more like a topical medication. Tmax, 2 hours for the parent drug molecule. It's about 1 hour for the active metabolites, so we'll be talking about shortly. The half-life is about 11 hours for the parent drug molecule as well as for the active metabolites. Metabolism. This medication will be hydrolyzed by the intestinal enzyme like esterase to OP1118. That's the active metabolites. So this active metabolites, that's the hydrolysis product, hydrolyze this isobutyryl ester motif to form the secondary alcohol metabolites. You can see the half-life. This medication has about the same half-life for the parent drug molecule as well as for active metabolites. So therefore, you can see this medication is dosed twice daily dosing, given the half-life is about 11 hours. Excretion. This medication is mainly excreted in the feces. You can see over 92% in the feces. In the urine, it's less than 1%. Contraindications. It's a non-hypersensitivity to fidaxomicin or other ingredients in DIFICID. In addition, with regard to drug-drug interactions, so this drug molecule doesn't have much drug-drug interactions. Given this medication minimally absorbed, it's not really metabolized by CYP enzymes, so therefore you can see it has minimal drug-drug interactions. Given the lipophilic profile for Fidaxomicin, it's a highly pretty lipophilic drug molecule, so therefore it's a substrate for P-glycoprotein, the efflux pump, so which is expressed in the gastrointestinal tract. But clinical studies showed there was no attributable effects. For example, if you give Fidaxomicin with the P-glycoprotein inhibitor like cyclosporine, the immunosuppressant, it doesn't really impact the clinical efficacy. Adverse effects. For both adult and pediatric populations, vomiting and abdominal pain. Specifically for adult population, greater than or equal to 2% nausea, gastrointestinal hemorrhage, anemia, neutropenia. For pediatric patient population, greater than or equal to 5% pyrexia, that's the abnormal elevated body temperature, diarrhea, constipation, and increased the liver enzymes, for example, aminotransferase for the AST or ALT. Rash. This is the major reference which I have used to prepare for today's video. Most of the medication information are based on the DIFICID prescribing information. This document is available at the US FDA website along with the drug manufacturer website as well. Finally, I want to thank you all so much for watching. If you enjoyed the video, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.